Okay, welcome back, everyone. In this next video, it's important to understand some of these terms because when we look at bony landmarks, you have to be familiar with terms so that when I tell you that right here is the supraorbital foramen and here is the mental foramen and here's the infraorbital foramen, you're like, what the heck is a foramen? So it's important to know these terms like foramen, fissure, meatus, canal, sinus. When we look at a foramen, there's lots of foramen that you're going to be held accountable for. A foramen is really a hole. It's a passageway. And through that hole or passageway that we see in the skull, many of them, you're going to have nerves and blood vessels that travel through there. Okay. A fissure is different than a foramen. A fissure that we see here is more like this elongated slit right here. It's a deep furrow, it's a cleft or a slit. And also through there, we're also going to have some arteries and veins and nerves that travel through there, similar to a foramen. A meatus is a passageway or a channel, and they're pretty elongated, these meatuses. It is really not just a channel, but it's a canal. And we have them primarily in the nose. We'll have a few meatus in the nose, as well as the ear. The nose and the ear are going to have a meatus, a canal. And the term canal is typically referred to or associated with ducts or channels. Okay, so it could get a little bit tricky between the two, and we'll differentiate them as I point them out on the skull. There's lots of processes that we're going to get familiar with. The process is a projection off a bone, which looks like a bump. And then a ramus is an extension of the bone that forms an angle. So we have that associated with the mandible. Okay, we'll see that in the lower jaw. When we look at some of these longer bones, this is looking at the humerus, which is the arm. There's a sulcus. A sulcus is a narrow groove. And we're going to see lots of fossas. And a fossa is a depression, a shallow depression. Here is a larger fossa right in here. This depression is called the iliac fossa right here. A trochanter is a large projection. And these projections, whether it's the greater trochanter or lesser trochanter, these trochanters are typically attachment sites for muscles. Wherever you see these trochanters, they're large projections that come off of bones. Muscles are going to attach there. A crest is this ridge. Crests are usually pointy or sharp, distinct, prominent ridges. A spine is a pointed process. So this right here is the anterior superior iliac spine. This right here is the anterior inferior iliac spine. Okay, you don't have to write those down. We'll get to it when we do the lower extremity, but spine is really just a pointed process. Lines are low ridges. Tubercles are kind of like trochanters. These are very similar to one another. A tubercle is just a smaller projection, right? So here's the greater trochanter, lesser trochanter. Here's the greater tubercle and the lesser tubercle. So these tubercles are just smaller, rounded projections. They're not huge and large. Then we have a tuberosity. A tuberosity is a rough projection, and they're not as distinct or obvious as tubercles. Okay, so there's a few tuberosities. Right here in the humerus, this is the deltoid tuberosity. It's where the deltoid muscle inserts. Then in some of these long bones, we have a head and neck, and that's pretty straightforward. This is the head, underneath it is the neck. A facet, you'll hear this term facet, especially when we cover the vertebrae. These are flat articular surfaces, and they're smooth. Think of the facets of a diamond, right? A diamond has many flat, smooth, articulating surfaces to it. Those are called facets. And condyles are smooth, rounded, articular processes. Okay, here and here. Those are condyles. We'll see them on the skull as well. They're called occipital condyles at the base of the skull. And then you'll hear a trochlea every now and then, which is shaped like a pulley. A trochlea is like a pulley that's here at the end of the humerus. It's a smooth articulating surface, and it's an important landmark for the ulnar bone. The ulna will articulate there.